I call this meeting of the House Human Services Committee to order. There is a quorum. Representative Frederick, have you had a chance to look and approve the minutes?
I have. I move the approval of the minutes.
Any discussion? Hearing none, all those in favor say aye. Aye. Okay, our first bill that we have up today, Chair Bierman, House File 3738. I move House File 3738 to be laid over for possible inclusion. Chair Bierman, to your bill.
Thank you, Madam Chair. Members, all this amendment does is move back the report date for the pediatric hospital-to-home pilot program that we passed in 2024 from a December 26 due date to December 27. So it's just regarding the report. This adjustment reflects the time it took to go through the RFP process and get the program going, which began its actual work in October of 25. Providers and the department have both asked for this adjustment so that the data can be collected over the full 2-year window that the program was intended to run and not to be cut short. As a reminder, this pilot was a one-time appropriation of $1 million to more quickly transition medically complex children who are all ready for discharge from hospitals to their homes through care coordination and home care nursing services. The metrics in the report will show the pilot's effect on reducing delayed discharge days, rehospitalization days, unnecessary emergency department admissions, and missed school days. So adjusting the report due date ensures the legislature receives a complete and meaningful evaluation of the dollars we invested. And that's all. Look for your support and hope to lay the bill over.
Thank you, Rep. Bierman. You have an A1 amendment. Do you want to?
The A1 amendment is simply to, on page 2, line 5, reinstate the stricken date and put in December 15th as the date that it will be actually required. And that would be December of 2027.
Any member discussion? Oh.
Sorry, December 26, 2026.
Okay, we move the A1 amendment. Any discussion? Seeing none, all those in favor say aye. 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 Okay, we don't have any testifiers. Oh, the amendment is adopted.
Thank you very much. I think I've explained the bill and the reasoning, and we can proceed to lay it over.
Any member discussion to the bill as amended? Okay, seeing none, assuming those were your final comments on the bill.
Thank you for your attention, and you're off and running to more bills. Thank you.
Thanks. We renew the motion to House File 3738 as amended be laid over for possible inclusion. Moving to Representative Virnig. Representative Virnig, the next bill on the agenda is House File 2295. Virnig moves House File 2295 to be laid over for possible inclusion. Rep. Virnig, to your bill.
Thank you, Madam Chair, members of the committee. Before you is House File 2295, a bill brought forth by Dakota County for $3.4 million in mental health crisis services funding. This bill would provide funding for mental health crisis services, including mobile crisis response, crisis follow-up and stabilization services, and embedding social workers in local public safety agencies. This bill has made a deep impact in Dakota County, and now crisis staff are co-located in 11 local police departments and the Sheriff's Office, working side by side with dedicated mental health officers. We cannot do this alone, and therefore are asking for your support to help fund this work with a one-time appropriation. I have with me several testifiers who will further describe the program, its impact, the need, and answer questions you may have. But before they testify, I'd like to share a story from a constituent and a friend who couldn't be here. She's a mother of 3 adult children, and last night she had to ask me, "What are you doing tomorrow?" And I said, "I have a bill up." And she said, "What's it on?" And I explained it, and she said, "I love that program." So once they had to call the police on their adult son when he refused to take his medication. Things weren't going well between him and his siblings, and she didn't know what else to do. A few days later, a social worker and a plainclothes police officer returned to their house to talk about services that they may have access to and shared alternative health emergency numbers. It was unexpected, impressive, and very helpful. The work that was done to train officers on mental health and the diverse needs of people, knowing that there is an alternative to 911 and partnering with social workers, means that she's not afraid to reach out in times of need, including calling 911. She said, "The program is awesome." Unfortunately, my friend and constituent couldn't be here to share her story, but she asked that I do. I have testifiers here who will tell you more about this awesome program.
Okay, we'll start with Emily Shrug. Please identify yourself for the record and begin with your testimony.
Good morning, committee. My name is Emily Shug. I'm a director in social services with Dakota County. Thank you for your time this morning. I would like to share some information about our program and the mental health needs in Dakota County. Mental health is a top community health concern in Dakota County. Mental health crisis calls are increasing in frequency and acuity, and this creates urgency for counties and law enforcement to work together to address these needs and provide the right services at the right time. Without timely intervention, individuals repeat cycles through crisis and other more costly services such as jails, emergency departments, homelessness. This drives up avoidable taxpayer costs and worsens long-term outcomes. Starting in 2019, Dakota County expanded mental health crisis services in partnership with our local public service agencies. Now, Dakota County staff, as the representative said, are co-located in 11 police departments and the sheriff's office, working side by side with dedicated mental health officers. This project and partnership has proven effective, and it's really transformed the way that we approach mental health crisis response. As one of our police partners said, this is about social workers and police officers working together to come up with long-term solutions rather than temporary solutions to a long-term problem. And by the numbers, just some examples that show the impact. In 2025, Dakota County's crisis team responded to nearly 20,000 calls and followed up, as was described, with 2,900 people following a crisis to really address root causes. And nearly 500 people were served with intensive therapeutic support services. Through a partnership with our Dakota 911 system, since 2023, 3,500 calls have been diverted from 911 to the mental health crisis team, and of those, 85% have been handled by the mental health crisis team without a need for law enforcement response, which provides more trauma-informed and effective service response. And just an example, sort of on an individual level of what this can mean in terms of right service at the right time. In 2024, an example is a residential address had 62 calls for mental health crisis response from 911. After that follow-up from the crisis team and the dedicated embedded social worker and the dedicated mental health officer, there was an 80% decrease in calls to that just one address. So that type of situation plays out repeatedly in Dakota County. And again, it's about getting the right services to people at the right time and creating a more effective and efficient response. I'd also like to just share kind of the situation with our funding for this program. So since 2021, this work and this impact has been made possible through an expansion of our mobile crisis team and embedded social workers embedded in those 11 agencies. We've been able to leverage local ARPA funding for that service expansion. And as those funds are now fully expended and, as you know, no longer available after 2026, we are looking to bridge that funding. DHS is in the process of developing an equitable funding formula, which based on population and other factors of need. And we expect that Dakota County will have sustainable funding once that model is implemented. Under the current funding formula, Dakota County does not receive an equitable share of that funding. So again, this is really about a one-time appropriation request for $3.4 million to bridge Dakota County to the crisis services funding formula and ensuring that these critical important services, as was described, continue to be available to Dakota County residents. So this investment in the model really will allow Dakota County continue to be a model for other counties as well. So with that, I'd like to turn it over to one of our Lakeville Police Department partners to talk a little bit about the local impact of these services and our partnerships at a local level.
Thank you so much, Director Shrug, and welcome. Please introduce yourself and proceed.
Commissioner, did you want to go first? No, please. Good morning. My name is Brad Paulson. I'm the police chief in Lakeville, Minnesota. And as was mentioned, we are one of those 11 agencies that have embedded staff. Thank you for the opportunity to share some testimony this morning about this program. 3 years ago, the Lakeville Police Department entered into a partnership with Dakota County to have an embedded mental health crisis response and social worker presence inside of our agency. Seeing the immediate success of this program, we created a new police officer position to pair with these embedded workers to provide that full-time partnership. We're coming up on 2 years of that full-time partnership being in place, and this has proven to be to provide a consistent, timely, and nuanced approach to those struggling with mental health in our community of nearly 80,000 residents. In 2025 alone, this team responded to, followed up on, or had contacts with nearly 1,800 individual calls. Some of those were repeat individuals. These mental health calls were rooted in a number of different challenges, as you could probably imagine, to include dysregulation, lack of essential needs, and death or loss of loved ones. Police officers are many times forced to be a Band-Aid, stabilizing a situation and moving on to the next priority or need. With this current partnership that we have in place, the transition from police involvement to crisis or social worker involvement is much more seamless and effective. This is more than providing a phone number or a list of resources. These are trained professionals showing up in person in that moment of need. This approach has certainly led to much more sustainable, positive outcomes, and an emphasis on sustainable. One quick example of how this team works involved a 911 call from a young college student who had recently been suspended and was in crisis with violent thoughts. The instability was tied directly to his educational challenges. Once our officer and embedded social worker were introduced to the situation, their work began. The social worker and officer were advocates, coordinating with university officials, student conduct coordinators, and campus safety to navigate a complex disciplinary hearing process. Because this gap was bridged seamlessly from police response to social worker involvement, this student was cleared to re-enroll at the university. A crisis was averted that day, a tragedy potentially prevented, and in the end, a young student was back on track pursuing his educational goals. Having embedded crisis response and social workers inside of our agency's walls, supporting our community's needs, has certainly enhanced our mission to protect and serve our community. Thanks again for your time and for your consideration of this important legislation.
Thank you so much, Chief Olson, for your testimony. Please stay around just in case of questions.
Happy to.
Commissioner Halverson, welcome back. Please introduce yourself and proceed.
Thank you, Mr. Chair. Thank you, members of the committee. I'm very happy to be in front of this committee to talk about this important bill and this program. As you heard, the outcomes are amazing. We really have changed lives and made seamless handoffs from our mental health providers on the scene directly into programs. I've always been a big advocate for meeting people where they are on the mental health continuum. And to the chief's point, a card and a phone number may be fine, but the seamless handoff is really what helps us make sure that we can reduce future calls and that we can get people the treatment that they need immediately. This program has won multiple awards nationwide, which I'm proud of. But more importantly, I'm proud that it continues to spread into municipalities across the country because of the work that we have piloted. We had fully intended that this would be funded through a realignment of some DHS grants. However, that realignment has not happened as fast as we needed it to. And so we find ourselves with a bit of a budget cliff. And I'm here to talk about making sure that you guys know that this is a temporary ask. We're not going to be back to say we need this funding again. Our intention at Dakota County is to work with DHS, work with this grant program realignment. If we don't find it, to find other sources of funding. But because this need came up quickly, we are asking for a bridge from you all. And what I will say is that for years we have been seeing, and I mean, I remember hearing from my police chief in Egan over the years about the strain that calls about mental health were putting on our local law enforcement. Their ability to respond to core services, crime prevention, public safety, really were hindered by the need to respond to mental health calls. And then also, making sure that the right people were showing up can be tough. Sometimes it's not a person with a weapon in a uniform that is the right person. And so making sure that we can de-escalate the situation and treat it with trauma-informed leadership is really important. And these partnerships, both for our social workers and for our police departments, have really grown our relationships with local law enforcement and allowed us to be creative in many ways. This is a single source of funding, but I will say Dakota County has worked to invest in those wraparound services to support law enforcement for many years, including building a SMART Center to help train law enforcement from around the country, or excuse me, around the state to help deal with mental health crisis situations. It's really impressive if you ever get a chance. And then also to ensure that we are providing mental health crisis funding at the county level. We have invested more and more in that over the years as pressures from COVID really saw a spike in the needs for mental health crisis response. So we have built that response. We also built a facility in Dakota County to help deal with mental health crisis. We have a crisis and recovery center. So this is really part of a larger investment from the county. We're just missing this one piece. It's a biennial request, and we ask for your support. Happy to answer any questions.
Thank you so much, Commissioner. With that, do we have anyone else in the public who wants to testify on this bill? Seeing none, I will move to member discussion. Representative Ganda.
Thank you, Mr. Chair. I really like the sound of this. You know, there would have been an extreme measure where we could have throttled down law enforcement and tried to move into more social work. But this is a better option where we have a strong police presence along with a strong social work presence. So I do think that this model is really, really good. My first question, I might have only one, is so it sounds like in your agency, the two cultures came together very well, a merging of the two cultures. I mean, they're like worlds apart in one way, and yet you bring them together, and if the merger happens well, then we can bring the best of both kinds of service to our people. Tell us more about that, and has that been the case in other agencies as well? Thank you.
Chief Paulson.
Yes, so I can certainly share our experience in Lakeville with our police department. And so, in law enforcement policing, we have our lane to operate in, and social services has theirs. And those two worlds have run simultaneously for years. Sometimes that challenges with the kind of spike in mental health related calls is many times there is not a criminal element to that call for service. It's a safety element. And that's where we get involved through a 911 call. So that's a lot of times our primarily and sometimes our only role in that situation. Let's just stabilize and make sure everybody's safe. Let's stop there. But then instead of walking away or saying, reach out, here's some opportunities for you, we have staff that can step in person in that home or wherever this is taking place, and to have that seamless handoff. So The worlds have always existed for many years, but we're finding, you heard right place at the right time. That's really what we're trying to meet, because that's what has the impact. To follow up with that, we may have an individual or a family that's really struggling, and we have repeated calls. And rather than us just continuing to go again and again, we will meet with this team and say, help us out here. And they have the resources and the connection to go and set up a meeting with that family for some of that aftercare work too. So it's really just merging those two worlds together a little bit that have existed for a long time, but a much more seamless approach and really more consistent because they work together every day.
Representative Gunn.
Thank you, Mr. Chair. That's good.
Vice Chair Gillman.
Thank you, Chair. And this question might be for the Commissioner. So you did mention, or somebody did mention ARPA funding. So I think this is something that the legislature is going to be hearing quite a bit. I spoke with another county yesterday, had a long meeting about ARPA funding running out. And again, this is money that came to our counties to help support things like this nature, and this fit the mold. So my question is, you know, looking at Dakota County, it's the highest, you know, 5th highest median income is in Dakota County. So this one-time carve-out, I feel like, you know, we will probably hear more of this when upstream things are being done with mental health and we're trying to meet the needs. How is the legislature going to be responsible versus, you know, your folks in your county? Why is this only one-time funding? Thank you.
Commissioner.
Thank you, Mr. Chair, and thank you for that question, Vice Chair Gillman. I am very confident that we have worked to deal with the fiscal cliffs that came along with the ARPA funding. It frankly allowed us to do a lot of innovation and to put resources into one-time projects such as building our Crisis and Recovery Center. But there were a few opportunities to pilot things that we just kind of couldn't pass up, and this was one of them. To expand it to all cities in Dakota County was because our early outcomes were so positive and so strong. We wanted all of our police departments to be able to have this, especially as we saw a mental health crisis becoming a bigger issue during COVID. So there was a direct COVID impact that we were experiencing. The success of the program is something that we want to continue seamlessly. And because expected grant funding didn't come through, we are asking for one-time funding. And as I said, I'm confident it will be one-time funding. If I come back here and ask for this again, you guys can all wag your finger at me. I'm not coming back for this issue. But what it will give us is seamless support for our cities without shifting it to our property taxpayers. We are all anticipating, I won't look at the chief because he doesn't set the budget, the city councils do, county commissions do. We are experiencing unprecedented levy pressure right now due to new programs that are being put on. And levy pressure goes directly to property taxpayers. And so we already know in Dakota County that we are going to be experiencing a significant property tax impact. Without, we don't want to put this onto cities or onto our property taxpayers, and that is why we're here. We are confident, and Ms. Shug is in close conversation with the department, that the changes to the grant program, the grant equity program, are going to happen. DHS has been also working with some hiccups, which I think are keeping this particular activity from being fully realized, but we feel like it's going to be fully realized, and that will be the best possible funding source for us. If it isn't realized, it is enough of a priority for Dakota County that we will look for other sources of funding.
Vice Chair Gillman.
Thank you. Thank you for that explanation, Commissioner. So I just want to take and ask you really quick, when you talk about the mandates, are you talking about the unfunded mandates that come from the state and the federal government that is like eating up a big chunk of your budget?
Commissioner.
Mr. Chair, yes, and welcome to County Day at the Capitol. You're going to hear from a lot of counties today.
Good.
In Dakota County, we anticipate the impacts, and we were just out in DC to talk about this as well. The impacts that are coming down in 2027 from HR 1 are going to result in us needing to hire 70 to 80 people to do Medicaid work requirement oversight. There is not room in the budget to do that. That is going to be a direct shift to our property tax levy of over 6%. And we don't have any other levers to raise that money to do that work. And I wish that we did. So we are finding ways to be as efficient as possible. Dakota County cut its budget 8.4% last year. We anticipate more cuts in the coming year, and those cuts are going to hurt. But there are some things that are just too important and provide too much return on investment and too much peace for our families that we can't let it go. So I'm gonna keep fighting for this one in my budget.
Thank you, Commissioner. Representative Jacob.
Thank you, Chair Knorr. I think I might have got my answer. I'm a former county commissioner, so the 3.4 million, exactly how long does that support the program to start with?
Commissioner.
Mr. Chair and Representative Jacob, and it'll be a biennial appropriation, so 2 years.
Representative Jacob.
Yeah, thank you, Chair Knorr. So you kind of alluded to, you don't want to put this on your property taxes, but if you don't get this funding, essentially that's what's going to happen. So as a former county commissioner, unfunded mandates just at every corner, that's exactly what I don't want to see happen. And so you, in your last answers, you mentioned about looking for other sources of funding. What, if you don't get this and you're not going to put it on property taxes, what are the other sources and how would you sustain this program?
Commissioner.
Thank you, Mr. Chair and Representative. Job one is that the realignment of the DHS grants will become more equitable and will give us that revenue that we need. We trust that that's going to happen. If it does not happen, we would look to other sources of grant funding in order to do that, or potentially have to realign some other programs. I don't want to do that because, like I said, this is part of a big menu of crisis and recovery response that we want to do, and you know how important it is to build that. As the kind of the hands and feet of the state government when it comes to mental health, as hard as it is to deal with the mandates, I do really appreciate the independence that the state gives counties to be innovative. And to me, this is a really important innovation. We just need a bridge to keep it going.
Representative Jacob.
That's all, thank you.
Representative Fischer.
Thank you, Chair Knorr, and I want to say thank you for bringing the bill forward. This is touching on one of the issues that we have out there is the funding of our mental health services as we're going forward. And how do we do this sustainably? Because what we're talking about are grants right now that are kind of one-time grants and then applying for grants every other year or every 3 years or whatever the cycle is. We need to think about mental health delivery services different than we do today. If somebody had a bad insulin episode, broken arm, heart attack, we're able to, the services, the mental health, the medical services that the different people provide would be covered by Medicaid or insurance or Medicare. The problem is we have not reached the point of treating our mental health program the same way as we do with our physical health. And that's the root of the problem, and we have to start thinking differently. One of the things that we are looking at is that we have embedded social workers out there, which is great. This is a huge step forward that's been very organic that has occurred to start addressing these problems. And now realizing we're connecting with the mobile crisis teams. The mobile crisis teams get some funding out there. And what we're doing is we're dealing with people's mental health. What we need to do is take a look at the root cause and how do we reevaluate the entire system. And when I say reevaluate the entire system is let's take a look at our embedded social workers and get consistencies established in state statute This is one of the things I'm working behind the scenes on right now with somebody from behavioral health and two of my local communities, is figuring out how do we make this work so that we've got things outlined that will be able to be reimbursed through the Medicaid insurance or Medicare system. This is where it becomes sustainable, because we do it if people have a heart attack, we do it if they fall out of a tree and get hurt, they do it if they're in a car accident. We should be doing it in the mental health services. It's just going to take a little time to get these pulled together. This is not something that's going to come over immediately, but it's something that we have to continue working on, because as we see here, otherwise we're trying to stitch something together with grants that we cannot rely on going forward, and we have to build a system that is going to be financially sustainable going forward.
Thank you, Representative Fischer. Representative Murphy.
Thank you, Mr. Chair. This is a question for the commissioner. So in Otter Tail County, we have about 60,000 residents. And if you're 80,000 residents, we're going to spend $3.4 million. That's about $4.25 per resident. Why not prioritize that in your county budget? Otter Tail County is going to have to. Why not prioritize that $4.25 per resident in your own budget?
Commissioner.
Mr. Chair and Representative Murphy, it's, this, as I said, is a bridge. It has been prioritized in our county budgets. However, with the shifts that we are going to be experiencing in the levy pressure, the more that we can do to keep this going seamlessly, not shift the counties, or the funding to cities and to local police departments, and to continue the program going as is. This just provides a short-term fix, not a long-term fix, a short-term fix for one biennium.
Representative Murphy.
We have the same problems in Otter Tail County. Our residents are showing, 30% increase in property taxes because of all the mandates that we're dealing with. We're all in the same boat. So we're no different than you in terms of the stress on our budgets. So for us to look at prioritizing ours, I think, that's something we have to do too. So it's not just your county. Thank you.
Vice Chair Gillman.
Thank you, Chair. I think a little bit off of that. We have 80-some counties in this state. We have an ungodly amount of counties, actually, compared to many other states. And there is a lot of, we're county ran, state supervised. And so I think this is nothing against the program. I think the program is great. We do something very similar. We involve our firefighters. I think many of us have stories like this in our communities that we're doing. And I think we have to think really big picture, and I think we have to ask ourselves, is this county ran, state supervised system that we have working for us? When we have this federal roll down that then we know gets passed on to our counties, is there a different mechanism and way that we could do this as a whole? Because there's a geographic advantage for counties like Dakota to be able to drive here to the Capitol to do a bill to ask for a cliff that I am sure many of our greater Minnesota counties also have. Again, it's not a dig on the program. It's asking a bigger question on, we've been to conferences, learning how other people are doing this, and maybe the way we do this different is reimagine how we do this county ran, state supervised. So there's not so much pressure back on our counties. And quite frankly, our rural and greater Minnesota counties get overlooked a lot because this process of just coming to ask for the bridge is just not as easy for some of our counties across the state. And so I just think as a committee, we're going to be asked a lot about this stuff, and maybe it's our time to explore just revamping what some of that could look like. I know utilizing technology at a state level could be helpful, not trying to take away the local control of options and what you can do and how you can serve your people. But if you're hiring, Commissioner, I think you said you're going to have to hire 7 to 8 more people to do just the work requirement. Is that what you said?
70 to 80.
70 to 80 people in one county. That's crazy. Like, maybe we can rethink this just a little bit. Thanks, members.
And that does not include the administrative cost, which is shifting to the counties at the same time. So,
And Mr. Chair,
Commissioner.
to be clear, it's 70 to 80 people in a different program. It's not in this. We're not increasing.
Correct.
Okay.
Correct.
This, yeah, okay.
We're talking about the changes to HR1, which also the SNAP program changes, which is changing the administrative cost and all those things. I'm hearing from all the counties. So just a quick question to Mr. Berg. How much do we have in the mobile crisis funding that we allocated?
Mr. Chair, members, the base amount in fiscal '26 for these grants is statewide is 16.9 million, plus another 1 million in tribal grants. In '24 bill, there was an additional 8.5 million or 8.4 million a year in '24 and '25 that it was one-time money for this program that carries through fiscal '27. But the base grant is 16.9 million a year.
So I think, members, to that extent, there is a need, and all the funding that we have in there goes to all the counties and all jurisdictions who need the mobile crisis, the same approach of trying to reduce. Chief, I don't know if you have seen, has there been a drop of the number of people that you're interacting with when you utilize a different model than just, taking them to jail, which is going to cost us a lot of money too?
Yes, thank you, Chair. It's a little difficult to quantify on a large scale because we're a growing community and, across the board, mental health crisis is just generally increasing. But we can say that we have a number of specific examples of individuals or families that we have seen drastic impacts with this program by stabilization, connecting them with resources that are much, much more sustainable.
Thank you, Chief. Commissioner, any closing remarks before I go to Representative Virnig?
Thank you, Mr. Chair. Thank you, members of the committee, for considering this and also identifying really the universe that counties and state governments are living in as we try to navigate the needs of our communities with the financial pressure that I know you guys are all feeling and hearing a lot about. And so I appreciate that. I believe strongly in prevention, in getting upstream, in making sure that people who are in crisis get the supports that they need before we are seeing interventions like jail or hospitalization. This is a much better way to treat people. And I'm so appreciative to hear about other communities that are exploring these kinds of options and putting these things in place. Really appreciate the investments that the state has made with their crisis funding. And as I said, this is a program that we believe strongly saves dollars, but more importantly, saves lives. And we want to preserve it for a biennium.
Thank you so much, Commissioner. To your closing remarks, Representative Virnig.
Yes, thank you for your consideration. As you've heard, this program is changing and saving lives. As my constituents would say, it's awesome. So I'd like to renew my motion that House File 2295 be laid over for possible inclusion.
Thank you so much. House File 2295 will be laid over for possible inclusion. The next bill on the calendar is House File 3520. Chair Fischer. You're doing joint? Okay.
In the middle? Okay. Are you Chris? Come on,
Good morning, Vice Chair Gillman and Chair Fischer. Please introduce your bill, move the bill and introduce it and proceed.
All right. There also is, there is an author's amendment. Would you like to do that first?
There's an A1 amendment.
Or A1 amendment, yes.
Yep. Did you want to walk us over what is in A1 amendment?
So that is a DHS technical assistance. They assisted on this, and one piece of it comes from another bill, soon to be introduced, that is proposing a change to the same specific mental health service that's in the bill that it's modifying.
Members, we have A1 amendment before us. Any discussion? Hearing none. All those in favor, please say aye. Opposed? A1 amendment is now adopted. To your bill as amended.
Thank you so much, members of the committee. The rationale behind this bill before you today is straightforward. We are aware that the increase increased access to mental health services is in need in most every part of our state and every county. A key piece to increasing that access is attracting and keeping mental health staff. To recruit and retain mental health staff, we must address areas in statute where there is confusing or outdated policies and requirements that are creating frustrating barriers. While specific areas of statutory confusion or statutory constraints can seem small in nature, when added together in our overall mental health system, they are contributing to staff burnout, adding a layer of confusion for those trying to access and provide care, and shutting the door on new individuals interested in entering into the mental health workforce, something our state desperately needs.
Chair Fischer.
Thank you, Chair Nor. This bill before you today represents many months of mental health stakeholders working collectively together to identify specific areas in statute where we can update mental health service regulations to better fit in today's needs. This has been an ongoing process that has been going on for a number of years. Last year, Representative Gillman and myself co-presented another bill where this builds on, is continuing to make sure that our system is working well. The bill was shared with the Minnesota Department of Human Services, and DHS technical assistance has been incorporated into the bill. Bill proponents stand ready to work with DHS if they come forward with further technical assistance. The intent for the bill is to be policy only with no cost. If any of the provisions are flagged to have costs, those will be addressed. Representative Gillman and I are proud to be authors together on this bill and to work in a bipartisan manner on something may be small, but these are meaningful steps that our state can take to increase access to needed mental health services across our state. And this also shows the impact that this is a very bipartisan thing. This is something that historically our both parties here in our state have worked very closely together to help build out our behavioral health system that really needs a lot of work. With that, we will now turn to our testifier, Chris Westergaard.
Good morning. Welcome to the committee, Mr. Westergaard. Please introduce yourself and proceed.
Thank you. Chair and members of the committee, my name is Chris Westergaard and I work at Touchstone Mental Health. Thank you for the opportunity to testify in strong support of this legislation. The bill contains changes to address some of the policies and requirements that cause confusion and frustration for our staff and for which we see alternative, modernized requirements that could be put in place instead. At my organization, our staff are the most valuable part of the services we provide. Due to our statewide shortage of mental health staff, we must do everything we can to best support the individuals who want to enter into and stay working in this field. I'll briefly walk through this bill, and then I'm happy to take any questions along with a few other people here to help field questions if needed. Section 1 of the bill excludes weekends and holidays from the 10-day window within which a diagnostic assessment has to be completed following admission to intensive residential treatment services, often referred to as IRTs. These diagnostic assessments must be completed and/or signed off by a mental health professional, and many programs have just one individual who can perform this task. And this requirement means that staff are having to work on weekends and holidays, which is leading to stress and burnout. This change will ensure that the diagnostic assessment is completed in a timely manner while relieving a bit of the stress on our frontline mental health staff. This change would also align with the 10-day window requirement for substance use disorder services that was passed in the last legislative session. Section 2 of the bill aims to clarify an area of the statute that has caused confusion in recent years. Under Minnesota law, the Behavioral Health Fund is used to cover a portion of costs for intensive residential treatment services and residential crisis stabilization services for Minnesotans on medical assistance and Minnesota Care. In recent years, there have been changes made to the area of statute dealing with the Behavioral Health Fund, including a change passed last session limiting the use of this fund in certain situations. These changes have resulted in a somewhat confusing statutory language regarding this fund's coverage of mental health service costs. This section of the bill is simply updating statute to more clearly reflect current state law to avoid continued confusion for mental health staff and our county partners. Lastly, Section 3 of the bill makes changes to our state's Youth Assertive Community Treatment Program, often referred to as Youth Act. The first change in this section adds a narrowly defined new path for bringing additional qualified mental health staff into this service type. Under current law, the prescriber role on a Youth Act team can only be filled by an advanced practice registered nurse, with a certification in psychiatric or mental health care, or a board-certified child and adolescent psychiatrist. Unfortunately, there are very few board-certified child and adolescent psychiatrists in the state, and it is exceedingly hard to find a child psychiatrist for any position. There are more board-certified psychiatrists, and these individuals have, as part of their training, time spent in child psychiatry. Right now, when a board-certified psychiatrist is interested in working on a youth act team, current statute prohibits them from being hired in the prescriber role. The language in the bill would allow them to serve in the role if they have demonstrated clinical experience and qualifications. The second change would allow registered nurses to be an optional member of a youth act team. In some situations, nurses can be a critical part of a youth act team. Under the current statutory rate setting structure, nurses can't be figured into the rate setting structure because they aren't listed in the statute as an allowable optional staff. If a youth act team wants to hire a nurse based on the client needs, this position goes unfunded, which isn't sustainable for those programs. Youth act teams would like to have the option of having a nurse to be part of the treatment team. The third change would allow a treatment team to provide care to a full range of youth act eligible children and youth ages 8 to 20, when teams demonstrate experience in meeting the developmental and clinical needs of the age range. In closing, I ask for your support of this bill, and I'm happy to stand for any questions.
Thank you so much for your testimony. Do we have anyone in the public who wants to testify on this bill? Seeing none, we now move to member discussion. Representative Ganda, did you have any quick question? All right. Representative Hicks.
I just want to say thank you. Finding a child and adolescent psychiatrist is like finding a tiny little piece of gold in a mountain of sand. So some flexibility in this space is greatly appreciated by families. So thank you.
Any further discussions? Just a quick two questions. You know, whenever I see page 5, line 5.1, notwithstanding, and we've already identified the two sections under 256B and chapter 245I, so notwithstanding sometimes can also create confusion. I know we're trying to solve the process. Is there any different way to address the issue that we're trying to deal with?
Could you repeat where the?
The 5.1, the place that we added the sections for behavioral health in the 245I. And we
Yes, I think, again, this just allows teams to have flexibility to add in positions that they need based on who they're serving. And again, that would be flexible based on that as well.
Any other question? And then the other question that I have is when we say qualified provider, which we adopted under the amendment, who qualifies for that? You know, whenever I see qualified provider with no listing, that will be the line 1.13 and 1.14.
Yeah. Part of that is it's already addressed in statute who is a qualified provider and other statutes. So it again allows the flexibility when again other individuals are able to be prescribers based on other statutory requirements. It makes it easier to comply, I think, is what that would be.
Just want to check in with nonpartisan staff. Will that be more sufficient, Ms. Sanderman, when it comes to the qualified provider?
Mr. Chair and members, we could certainly tighten that up with the cross-reference if this bill were to go forward to clarify who a qualified provider is.
Thank you so much. With that, your closing remarks?
Thank you so much for your time, and I appreciate the testifier coming in today as well, and just all the people that have come together. Grateful to work with Representative Fischer as well on this, and look forward to more positive things for the state of Minnesota. So I would renew my motion to have House File 3520 be laid over, please.
House File 3520 as amended is laid over for possible inclusion. Thank you so much for the presentation. Now we move to Chair Fischer's bill. House File 3666.
Good morning, Chair. I'd like to move that House File 3666 be considered for being laid over. And I have an amendment.
You have an A1 amendment. Did you want to move your A1 amendment?
I would like to move my A1 amendment. The A1 amendment does several different things. First of all, it does a little bit of reorganizing to make things a little bit more logical in the process of being laid out. It clarifies that for contract purposes, that if a county is contracting with another county, that would be not considered third party. It addresses language for making sure that all contracts have a grievance process and client information. Did some work and did not find that being referenced in statute elsewhere, so we want to make sure we have that in statute. And also in statute, making sure that when contracts are being done, that the counties have some kind of regular audit process that's going on during it. And this is something that would get my bill in the shape that I would like.
A1 amendment is before us. Members, any discussion? Hearing none. All those in favor of adopting A1, please say aye.
Aye.
Opposed? A1 amendment is now adopted. To your bill as amended.
Thank you, Chair Knorr. Committee, the bill you have before you in some ways is rather controversial because it is bringing up the situation of having no more contracted case management services. In other areas, there's a lot of agreement. We need to take a look at the system. And what I'd like to do is, first of all, lay out what we are seeing in the system. Is our current case management system is very fragile. And that's because we've underinvested and at the same time over the years greatly increased the responsibilities that are out there. And as a result, in some instances, more and more counties have moved to third-party providers because the reimbursement rates we have coming in don't cover all the services, and some of the providers have struggled with that same issue. And one of the things that we have to keep in mind is years ago, it used to be case managers, used to be the goal where people would be at the top of their career. Case management were done by people who were around for a long time. There was not as much turnover in case management as there is today. Today, case management is more of an entry-level position. This kind of which is very disturbing to me because when I take a look at case management, I'm thinking these are the people that know everything in the system, can help make sure that the clients that they're working with are being properly guided and receiving the services that they need. Now what we have as a system is where it's not unusual. You have people who are very new in the process. There's a high turnover rate. I've heard from many people who've had case management where their provider, their case manager turns at least once or twice a year. Now, that's not everybody, but it's happening, and I'm hearing these complaints more and more. That indicates we've got a system that is under stress, and that's why I say it's very fragile. So the bill I have is doing a variety of different things. Number one, it is asking for a work group out there to take a look at how do we address case management? What should we be having in it? What should caseloads be looked at? Is reevaluate the entire system. Then on top of it, the next thing that it's doing is saying, let's take a look at the rate reimbursement structure. So if we're going to be making sure that we have the requirements out there, does our rate and reimbursement structure that we have match what we're requiring? And I think this starts getting to underlying cause of a lot of the problems out there is that a lot of times when things are being contracted out, it's because it's being seen as a way to save money. I also know that when you contract out, at a certain point, you start losing a little bit more control over the process. As an example of that is that when I've run into people who've had problems with their third-party case managers, they've come to me and they're asking basic questions and they're saying, well, I don't know who else to complain to because they don't understand. Is there a grievance process? Who do I go to? So there's some things that feel to be missing in the process. So we're trying to address a variety of different things. The bill I have, I know is not perfect. It still needs a lot of work, and I appreciate the feedback that I've been getting from people on both sides of the aisle, from providers, from counties. I'm committed to continuing working on this because we do have to move this forward. As an example, one of the things I know that will be tweaking is the dates that are on here because I want to make sure the work group comes out with their report and then DHS can take what the reports are being recommended and start building the rate study off of that because otherwise we're going to get ourselves right back in the same problem. So there's a number of things I'm looking for feedback on. This is something that I know I appreciate Representative Gillman reaching out to me. This is something she and I are committed to continuing working on, and I look forward to the discussion and the feedback because we want to make sure that we can take our case management system from a fragile system as it is now to something that is sustainable and meeting everybody's needs going forward.
Thank you, Chair Fischer. Vice Chair Gillman, you have an A2 amendment. Did you want to move the A2 amendment?
Yes, Chair.
A2 amendment is before us. Can you please help us understand what is in A2?
All right, so this amendment creates a waiver case management advisory working group without a sunset on contracted case management. The working group evaluates service quality, workforce stability, funding adequacy, and oversight across delivery models. And again, it brings together counties, providers, case managers, people receiving services, and advocates. The goal is to make sure any future policy decisions are based on data and workforce realities and system capacity. The working group reports recommendations back to the legislature before any structural changes can occur. Again, the structural changes should follow the evaluation and not precede it. Again, we can't put the cart before the horse here. And so the way that the bill sits right now, when I talked with Representative Fischer, I just talked about like it would decimate counties right now. The modality that they use to do case management is fragile already, and we have to protect, 60,000 people that are using those services. So this amendment is something that I brought forward because it, I think is valuable. Never thought I'd be excited about a working group, but we do, gosh. I just think it's very vital that we include all stakeholders in those conversations.
Chair Fischer.
Thank you, and thank you, thank you, Chair Noor. Thank you, Representative Gillman. I appreciate what you're putting out there. And what I appreciate is, as I take a look at what you propose and what I propose, I can see that mine is overly prescriptive and definitely use some work. And I like where yours is going. I think it's could have some more details in it. And so I'd like to do is ask if you could pull it back. And it's something that I would like to have you working with me, not only on this part of it, but the rest of the bill also, so that we can have a much better bill that will be able to address the problems that we are all seeing.
Vice Chair Gillman.
Thank you so much, Representative Fischer. And I will, at this time, in good faith and excitement to help carry the load with you, withdraw my amendment.
A2 has been withdrawn. Do we have any testify? No. Mr. Clapper, welcome. Please introduce yourself and proceed with your testimony.
Chair, excuse me, Chair Noor and committee, my name is Jim Clapper. I reside in Ramsey County. I'm a parent of a young man with Down syndrome and a co-founder of an advocacy organization called 18 Minnesota. I'm in full support of HF 3666, which is intended to eventually eliminate contracted case management services effective in July 2029, as well as establish a working group to manage the transition. Parents and families tell us they go through 2 to 3 case managers per year who are contracted employees with little experience and who never really establish a good relationship with their clients, local service providers, and the parents and families of the clients. A good case manager is the most critical link between the client, the family, and the waivered services that people with intellectual and developmental disabilities are entitled to. As I'm sure you know, the legislature has a long history of trying to improve the quality of case management services. Case management reform was a hot topic back in about 2011, 2012. From that, case management redesign project became an official project in 2014, mandated by the legislature. The redesign team started meeting and met through 2018, which included 12 regional community events across the state to get input on the redesign. But sometime in 2020, the redesign project was unilaterally and quietly dropped by DHS due to other priorities. The fact was verified when our A-Team Minnesota met with the Director of Disability Services in the DHS building in September 2024. I've been participating in a community advisory committee for the Ramsey County Disability Services and Supports, over this past last year. I've worked with several good professional management people at Ramsey County, and they have been quite open about how they are managing case management services. At this point in time, there are about 26 manpower vendors providing case management services, and they are looking to add even more vendors to reduce the wait list for services and the turnover. I can't imagine how difficult it is to manage 26 vendors for case management services, but it's got to be very challenging. These vendors provide about 250 case managers serving about 10,000 people who are entitled to that service. The 26 vendors struggle to hire, train, and retain case managers and end up hiring inexperienced people. This is real interesting given the rate for case management services is approximately $23.15 per unit, which is about $92 per hour, which seems like enough funding to retain good case managers. Case management services are so critical that it should be brought back inside and not contracted. HR 3666 includes provisions to set up a working group to finish basically what case management redesign was supposed to do. I hope the working group takes a hard look at the damage that MinChoices has done to case management services and possibly recommending eliminating MinChoices altogether. The MinChoices project took away assessment work from case managers and established a whole new level of people that we don't really need. Case managers should be given back the screening tools they used to utilize to properly assess their clients. The consolidation of case managers and MinChoices assessors would provide excellent simplification and cost savings. I sincerely hope that HF 3666 is successfully approved. I want to thank Representative Fischer for carrying this bill. If it gets adopted, I hope that I can serve on the working group to make the necessary changes. Clients, families, and parents and service providers will be much better served if this bill is successful. Thank you for taking my testimony.
Thank you so much, Mr. Klopper, for your testimony, and thank you for volunteering to be on the working group. Please stay around. We may have some questions for you. The next person on the list is Mr. Nockber. Welcome to the committee. Please introduce yourself and proceed.
Rep. Fischer, Chair Knorr, Chair Schumacher, and members of the committee. My name is Jeff Nockbar. I'm the Public Policy Director for the Minnesota Brain Injury Alliance. Thank you for the opportunity to testify on House File 3666. The Minnesota Brain Injury Alliance is a nonprofit organization dedicated to the over 100,000 Minnesotans living with brain injury. In full disclosure, we have been a contracted waiver case management service provider for over 20 years. We felt then, and we still feel now, that our extensive experience and expertise in brain injury services and supports puts us in a unique and beneficial position to support people to enhance their quality of life after brain injury. We applaud and commend Representative Fischer and others for their deep and long-lasting commitments to helping those living with brain injury and other disabilities by improving our system and holding accountable those individuals and organizations who get paid to take care of Minnesota's most vulnerable. So we strongly support the HF 3666, the efforts to increase accountability, to increase oversight, competition, and insurance of high-quality case management services. We're proud of the services we provide, and we welcome increased accountability. We stand ready to come to the table, roll up our sleeves as we have many times, and get to work on the reforms that are desperately needed to improve our system of providing home and community-based services. So we support pulling together the quality working group and the rate study. Medical assistance, you don't need me to tell you, is under severe stress, and we need to get the most out of every Medicaid dollar that we spent. So our concern is with the sections of the bill that prohibit counties from entering or renewing waiver case management services contracts after July 1st, 2029. This is simply untenable. There's no way a change of this magnitude and complexity can happen in this short of a time span. I mean, if there's anything we can learn from the recent experience with DHS and fraud fighting efforts, is that taking a hammer approach to these kinds of problems leads to bad outcomes for the individuals and families who are most reliant on the actual programs that we're trying to fix. So we need a much more surgical and strategic approach. I mean, if I got to choose which policymakers I got to work with to redesign, reform, and rebuild and remake our system, Representative Fischer and many of you would be on the top of that list. So please reconsider the hard setting of a sunset date for counties' contracting ability in this bill. I mean, if that's the direction we ultimately go in, so be it. But we think it's premature to assume that this is all going to be settled by July 2029. So thank you for your time.
Thank you so much for your testimony, Mr. Nokba. Please stay around for questions. Jillian Nelson, welcome to the committee. Please introduce yourself and proceed.
Welcome. Good to see you again.
Good morning, Chair Noor and committee members. I'm Jillian Nelson. I am the Policy Director for the Autism Society of Minnesota. This may surprise you. I do not have a well-written speech this morning because I think that this is truly a conversation. And I cannot be any more grateful to Representative Fischer for spearheading this. He was in a very heated email chain with my own case manager just a few months ago, which is no longer my case manager. I am now on number 2 for the year. But I also don't necessarily think that getting rid of contracted case management is the absolute right move. I do believe that there are some counties, such as Representative Hicks' own county, Olmsted, that would do a beautiful job with this. But then we have to also look at places like Ramsey County, where the only people I hate communicating with more than my case management company is my county. They can't keep anything straight. I mean, just this week alone, I've already been on the phone with 12 different people trying to get my medical assistance reinstated because they lost track of a payment. I believe that if we do this right, if we build a great work group and we come together with all of the right people at the table, we can design something that is a hybrid between county case management and contract case management. What we really need is training. We need culturally competent training, and not just to serve various cultures such as the LGBT community or various ethnic cultures, but also to serve the disability community as our own culture. We are very much a culture, and often our case managers are not competent in serving people with disabilities in a culturally sensitive way. We need some of that training to be delivered by disabled people. I get the best results from anyone I interact with when I train them about the spoon theory and what living with a disability is like. We need to make sure that the right people are at that table. I would really like to urge that we specifically name the Disability Law Center, ARC Minnesota, and the Autism Society of Minnesota. These organizations represent very specific groups that are often underrepresented in these conversations, and we cannot have a conversation about case management without making sure that a neurodiverse affirming group is at that table and that a disability justice-centered organization is at that table. All in all, I think this is a great start, and I am so proud of this committee for bringing this forward as someone who has an abundance of gray hair simply from trying to navigate case management. And I know we can do better, and I know we will do better, and I just want to thank you for being so thoughtful and considerate with this bill, and I look forward to working with everyone to make this bill the best that it can be. Thank you.
Thank you so much for your testimony. Please stay around just in case of questions. We have Ms. Molina. Please welcome to the testify table. Introduce yourself and proceed.
Good morning.
Thank you, Mr. Chair and members of the committee. Good morning. My name is Katie Molinaire. I serve as a Social Services Deputy Director in Ramsey County. I lead our Aging and Disability Services and MinChoices Division. I also serve as a co-chair for the Adult Services Committee of MACSA, or the Minnesota Association of County Social Service Administrators. I'm here today on behalf of MACSA to testify in opposition to House File 3666 as currently written. This would result in significant negative impacts on Minnesota counties and the people that we serve. Negative impacts include a loss of client choice, reduction in the availability of culturally specific case managers, and an increase in county costs to absorb larger numbers of case managers and support staff. Many counties contract with community agencies to provide waiver case management services to older adults and people with disabilities. Our community partners are needed to meet current need for case management services across the state of Minnesota. In Ramsey County, we do have nearly 11,000 residents who are served through contracted waiver case management, and this does make up a majority of our waiver case management service delivery. We contract right now with about 25 community partners who work with us to provide those services. Counties also use contracted case management to serve people who live outside their direct service area. This is a benefit to the residents we serve because they have a case manager who's familiar with their community and local resources. Case managers, as mentioned by some of our previous testifiers, are responsible for ensuring people's safety, access to services, and stability in the community, tasks that require time, expertise, and coordination across multiple complex systems. Our contracted case management providers bring a lot of value to our services. Community-based organizations are often well-equipped to serve racially and ethnically diverse residents with dignity and cultural competence. They're more likely to understand cultural norms, languages, and community dynamics, leading to more respectful and effective service delivery. Client choice increases with the use of contracted case management agencies. A balanced model of government and community providers ensures equitable access to services, especially for those who may distrust or have been underserved by government systems. There are many factors that are impacting case management across delivery models, such as workforce shortages, caseload strain, and recruitment and retention challenges. A root cause impacting the system is that the reimbursement rate for providing waiver case management has not increased since 2015, 11 years. These root causes deserve focused attention before statewide structural changes are implemented. MAXA respectfully urges the legislature to pursue a deliberate, data-driven approach that evaluates workforce sustainability, funding adequacy, and service continuity prior to making long-term structural decisions. Minnesota counties share the legislature's commitment to ensuring high standards and accountability in home and community-based services and waiver case management. We support strengthening and studying the system before making statewide structural changes. This includes the work group, as Representative Gillman's amendment suggested, and the rate study. Thank you for your time. I'm happy to answer any questions.
Thank you so much for your testimony. Please stay around. There's some few questions from members. The next person on the list is Ms. Sankatia. Please welcome to testify table and introduce yourself.
Thank you, Chair Knorr and members. Thanks for the opportunity to testify today. My name is Michelle Sancartier, and I serve as the Director of Public Policy and Advocacy for the Minnesota Social Service Association. I'm speaking today on behalf of our members. We have thousands of human service professionals across counties and community providers across Minnesota. About a third of our providers are case managers. I'm here on behalf of our members to respectfully oppose HF 3666 as written. Case managers, as others have said, not going to belabor the point here, but play a critical role in helping people with disabilities and older adults across services live safely in their communities. Everyone in this conversation shares the goal of strong, high-quality case management. But this bill moves toward eliminating contracted case management before we fully understand what's driving the challenges in the system. Additionally, this bill is at odds with choice and compliance as outlined in federal requirements in the Olmstead Act. Across both counties and contracted providers, case managers are facing workforce shortages, heavy caseloads, and reimbursement rates that have barely changed in more than a decade. I want to emphasize, our previous testifier talked about that as well. The last rate increase in 2015 was 1%. So the cost of living since then has increased 37%. Changing who employs case managers doesn't address underlying challenges, and structural changes this large should follow a careful evaluation of the system, not come first. In a moment, you'll also hear from one of our members, Carrie Schuster, CEO and co-owner of Thomas Allen, who can speak to how these pressures are affecting waiver case management services across Minnesota. We look forward to continuing this work with the committee on solutions that strengthen quality and support people with disabilities across our state. Thank you.
Thank you, Ms. Sankati. Welcome, Ms. Schuster. Introduce yourself and proceed.
Thank you, Chair Knorr and members of the committee for the opportunity to be here today. My name is Carrie Schuster, and I'm the CEO and co-owner of Thomas Allen. We provide services to people with disabilities and currently contract with 21 counties statewide to serve over 10,000 people through contracted waiver case management. and I'm here to respectfully oppose HF 3666 as written. Our opposition is not about protecting a business model. It's about protecting service stability and ensuring that reforms strengthen rather than destabilize a system that vulnerable Minnesotans rely on. I've worked in contracted case management for over 20 years. Every day, case managers help Minnesotans with disabilities access services, maintain stability, and live safely and independently in their communities. Case management also protects public dollars. I have dozens of stories that reiterate this, but in interest of time, I'll share one brief example. A 55-year-old man we served in rural Minnesota needed assistance with basic daily living. He couldn't bathe, use the bathroom, or leave his home independently. Through waiver case management, modest home modifications and durable medical supplies were authorized. Today, he no longer requires ongoing services and lives independently without government assistance. That's strong oversight and responsible use of waiver dollars. While we share the goal of improving quality and accountability, this bill eliminates contracted case management before fully examining the root cause of industry challenges. Across both county-operated and contracted models, the system is under significant workforce strain. Rates have not increased in more than a decade, as you've heard, while inflation and operating costs have risen substantially. Workforce shortages and administrative burden affect quality regardless of the employer. Even with a 3-year runway, designating this service for elimination will immediately slow hiring, reduce capacity, and limit long-term workforce investment. As community capacity decreases, demand does not disappear, it shifts. Historically, when community infrastructure erodes, costs reappear in high-cost crisis and institutional settings, increasing fiscal pressure on the state and the counties. Structural changes of this magnitude should follow comprehensive evaluation, not precede it. For these reasons, we respectfully oppose HF 366 as written and welcome continued collaboration on thoughtful and data-driven improvements. I'm happy to answer any questions. Thank you.
Thank you so much. Please stay around and we'll see if there are any direct questions. Do we have anyone in the public who wants to testify on this bill? Do we have anyone going once? Member discussions. I have a couple of Representative Coran.
Thank you, Chair. Thank you, Chair Fischer, for your bill. I just want to say I really appreciate that, there's a lot of issues that come up in the legislature and specifically in this committee. We're not sure really where to start, but we know there's an issue to tackle. And I appreciate that you've developed language as a starting point and that you're open and honest about that being a starting point and acknowledging that there's an issue. And it's very clear that, I think everybody in this room wants to get to the root of the issues that we're talking about. And so I'm grateful for all the folks who shared their perspective on how this could be workable. And I'm grateful that you're working with Vice Chair Gillman to make sure that we're not leaving anybody behind. So thank you for that.
Representative Buck.
Thank you. Thank you, Representative Fischer. And my first question is how would the county handle this transition? It seems like we just heard earlier all the unfunded mandates put on the counties. And it seems like their workforce would change. And it also seems like there would be budget challenges for counties to implement. What's your thoughts on that, Representative Fischer?
Representative Fischer.
Thank you, Chair Norris. Thank you, Representative Backer. This is one that, in terms of how the counties respond to it, it's going to look different depending on what counties are. Some counties have very little for contracted case management. Some counties have quite a bit more. For example, I hear that supposedly Ramsey County would need 300 additional people that they would have to hire. So it's going to look much different. In some counties, it might have to be a longer ramp-up time than others. That's why we're having this discussion, to figure out what that would look like and where is it appropriate. I think that one of the biggest problems that we're seeing out there is that case management has changed substantially over time. The requirements have changed substantially over time, and our funding has not. As we've heard, it was 1% 11 years ago, and inflation has been much greater. I think that is some of the things that we have to take a look at. That's why you see the work group out there. That's why you see the request for the rate study out there to make sure that we can get these answers. That might impact what the date would be back there. I mean, well, I've got a date out there. I am not married to that particular date or other circumstances around that. Certain things have to happen to make sure that we get this done right. I will say that in terms of accountability is really, really important, because when it fails out there, as I've seen, it actually caused waste in the system, substantial waste in the system. I have an instance last year where the third-party case manager, basically, in my opinion, drastically failed in what they were doing. And the people were living in a rental situation. We had made tens of thousands of dollars to the rental place to be able to address their needs, take care of their needs, so they would need no ongoing service on a daily basis at all. They could take care of all their needs. The problem is that as the case manager was working on things, there was nothing putting together an ongoing lease. It was a month-to-month lease. That changed. So you think of it, you're spending tens of thousands of dollars of taxpayers' money on improving a facility to take care of a person's need. What happened in the process? A new landlord came in. The new landlord came in, and as soon as the last improvement was made, said, oh, I'm going to evict everyone. I'm evicting everybody. I'm evicting them out. And so here we are. We've made tens and tens of thousands of dollars improvements that are now no longer usable. Something that made the living situation great so that these people could live without assistance, having to evict them and put them out elsewhere would end up causing a situation where they would need 24/7 service. On top of it, the number of people that had to be engaged in the process, the case manager did not have an understanding if somebody's at risk of eviction, where did it go? We ended up having myself, 2 senators involved, legal aid involved. It ended up in the judicial system, the sheriff, the county deputies, the local police chief was involved. At a certain point when I called the county had no clue what was going on. They ended up getting another dozen people involved from what they told me. So here's something that, because of a simple failure, we ended up with a system not using our resources in the most efficient way and causing a lot of strain. Think of the strain that is on that individual family unit then, is not knowing what's going to happen, where they're going to end up, and are they going to be able to take care of themselves. Think of that one through, and it was because of failure of things not being able to be connected, where if something's going wrong, the case manager should have known who else to contact. I knew more than she did as in the homeless world, and I was just stunned at that. So these are some of the things that can happen. But it's also being addressed by the work group, is taking a look, what are things we need to get out there? Because it's obvious to me there are some things missing in basic training. There are some things in caseloads. Do we have too much on? That's why we need to take a look at the overall system. And that's why it's hard to give it a time frame as how long it would take, because there are so many things wrapped into it. I will say I do have flexibility on the date to make sure that we get this done right.
Representative Beck.
Yeah, Bob, thank you, Chair. You know, the concerns that we see is, it seems to, and we've heard this with the early testifier, this could inhibit choices. And what works in Ramsey County doesn't work necessarily in Traverse and vice versa. And what it sounds to me is, with the first question is that there would be a budgetary burden put on the county, because anytime you overhaul a system, it seems like government finds the most expensive way to overhaul a system. Of course, and I could be wrong, hopefully I'm wrong, but it seems like in the past. It also seems when you, of course, you know, the story that you just shared with us would be additional training, expanding reports. One of the things I hear from my counties, and I would suspect you do too, is that we're spending more time on reports instead of providing services. So one thing that you said, and my next question would be, would this be an effective anti-fraud measure?
Chair Fischer.
Thank you, Chair Knorr. From what I am seeing in the system right now, in terms of things we don't have, first of all, I'll give an example. It could be an effective fraud prevention system. I don't see any fraud out there. I don't see that allegation at all. But there's a lot of things we have that the system has changed that we don't have in statute anywhere. And so at a minimum, there could be waste occurring in there. Is, if you take a look at case management, is what is an expected load, what isn't? I know in some areas like targeted case management and mental health services, there are certain requirements that you have for loads. In other areas, there's nothing. There hasn't even been discussions on it. So these are the questions, particularly if you've got a failure in services being provided, what is causing that failure? You know, so these are things that we take a look at. You also brought up the question of the cost to counties, and this references something that Representative Keeler mentioned earlier is, should we be rethinking our entire system? We've been having group meetings on this whole process. This bill I've got before you here. One of the things that was mentioned in one of the meetings, do we need to re-examine how we're delivering services? Should it remain as a county or should it be in another form? So that is also something out to the side. I'm not tackling at this point, but it's also something that would also address the need of, if we're delivering it differently, that would address the burden on the counties.
Representative Beck.
No further questions. Thank you.
Representative Gant.
Thank you, Chair Knorr. Chair Fischer, question. I think this is of sufficient complexity that we can lose the forest for the trees. I think to a lot of us, it sounds, you have to still convince us that there's something wrong with the current system. We know it's not perfect. We know it's not probably doing as well as it could. Are there ways to either revise the current system, or does it need to be completely ditched and we adopt the new system? So my question is, if we were on an elevator headed for the 100th floor, how would you convince me, A, we have a problem and what is the problem, and B, how does your remedy solve that problem? Thank you.
Representative Fischer.
I would say that from hearing from people who've received services and how the frustration that they've had in that, I think from the testifiers we've had here, they've all acknowledged that the system needs help, that the system is broken. I think the only area that we have contention around right now is should we be having any contracted case management at all? If we do, what should it look like? And if there's something being done, what is the drop dead date? I'd say those are the two areas of contention. I think everything else out here is something that we all agree we need to work on and solve, regardless of what I've got for a drop dead date or that part of the bill.
Representative Gant.
Thank you, Mr. Chair. So once again, in the dynamic going forward, is there any chance that contracted services could still hit the threshold of what we're trying to do in terms of quality of outcomes? Or is there some reason why contracted caseworkers can't hit that bar? Thank you.
Briefly, Chair Fischer.
Thank you, Chair Knorr, Representative Gander. There is a possibility of something along there. Based on some of the feedback I've heard so far, at a minimum, I know that we'd have to provide a provision in there that if there's a request from the county to the commissioner, that something could be done for contract case management. And the examples that I was thinking of quite a bit of that is when we've got our smaller counties in the rural part of the state where you've got maybe only one or two people for the county doing this work. They're not going to have the expertise of everything across. So I could see that there could be something happening. As you can see, I've already got the thing is making sure counties could contract with other counties, trying to solve some of those things. So, that is an area I'm open to. I'm not saying completely no, but I'm saying, let's talk about it. Let's try to figure this out as we go forward. And I appreciate the pushback. I appreciate the questions being asked. So thank you for that.
Thank you, Mr. Chair.
Vice Chair Gillman.
Thank you, Chair, and thank you, Representative Fischer. So, quick question, has a fiscal note been requested on your bill?
Representative Fischer.
Chair Knorr, as of this point, I've not requested a fiscal note. I've not seen one for it yet.
Okay.
Vice Chair Gillman.
Thank you, and I'll just follow up with what Representative Gander was just talking about. Has the people that brought this bill to you, are these, stories that you've heard, is it a systematic failure, or has it been just certain stories that you've heard and that you've been a part of that are few, or are you seeing it as a bigger issue?
Just to address the fiscal note, yes, Mr. Berg, if you wanted to address that.
Mr. Chair, members, I actually requested the note while we were discussing it as amended. So there is a request.
Amazing.
About 10 minutes ago.
Thank you, nonpartisan. That's great.
Chair Fischer.
Thank you, Chair Knorr, Representative Gillman. As we're looking at this, I have seen enough issues out there that it is indeed, there's no doubt in my mind, there are structural problems out here that need to be addressed. For some people, it works very well. For people outside of the normal process, it does not. We've heard repeatedly from people that there is a lot of turnover. I've had social workers themselves tell me that we need to take a look at the system. And what I'm hearing is the concern, once again, is not so much around the basic core of, yes, we've got to examine what is required. We've got to make sure there's consistent training out there, because the system has evolved and our statutes, the way we implement things, has not kept up with it. Things have evolved greatly over the last 11, 12 years since this was last looked at. In addition, we've already heard a big part of the problem is we haven't looked at the compensation of it. What is the reimbursement rates? How does that get overhauled? And it's going to be a lot of work, because there are so many different types of case management, and there are also so many different services that we have that require case management out there. Some of them are in programs that right now have got a high, contract case managers are not providing the services in the high-risk programs right now, but they do refer people and work with people in those programs. So there's a lot of connections we got to make sure that we're keeping an eye out to make sure that the case managers know what they can and cannot do. If they see things, how they get properly reported. I mean, things have changed in ways that 11, 12 years ago we did not imagine today. And so as a result, we've really got to spend a lot of time. And in terms of the bill itself, the bill was originally brought together by myself, is working with the groups as I've been assembling different people and talking to them since probably April of last year, when I first took a swipe at this and realized it's a much more complicated and bigger problem out there that's going to take a number of years to overhaul the system. I'd say this is probably at a minimum a 2 to 4 year process once we get things set up and started.
Yeah, thank you so much. And again, I just think, as we've heard, opposition, to this bill and support for this bill. I just think we really need to look at just ultimately what can we do to, talk with the folks that are not only receiving the services but that are providing it. And I just would hate to have thousands of folks go without services when something that is already working in the private sector. And what are we going to do about that? So thanks for your willingness to lay this over and continue to work on it.
Representative Jacob.
Thank you, Chair Knorr. Representative Fischer, first of all, I wish I could talk as fast as you.
It's a compliment.
So, as a former county commissioner, this just really runs completely contrary to so many things that I learned as a county commissioner. Any place where we were able to reverse the process of government running, say just like, as an example, our county surveyor. We privatized that to a local company, saved hundreds of thousands of dollars, had much more control over it, were able to get the work done faster. Same thing happens in road construction. Many times counties will, we can do this better than private sector, and start buying machinery, and eventually they just learn that they have this overburden of employees and inability to manage them as well as what you would through the competitive bidding process. So, a lot of problems with this. I don't really see the counties asking for it. I think taking the flexibility away from the counties, that's a major concern to me. But I think here's what my question will come down to. Once we bring people on as employees at the county, they become unionized and we're unable to fire them. We can't have the efficiencies that we have when we have a private sector competitively bidding. And quite frankly, if they're not doing the job we want done, we can fire them. But once we hire a county employee on and they're there past their first year, we lose control of that. It becomes an ongoing burden for the taxpayer. So I think my specific question for you is, how do you see eliminating that ability for the counties to essentially have this competitive bidding process through the private sector and have that ability to have control over that and put that all in the government's hands? How do you see that as being an advantage to the taxpayer.
Briefly, Chair Fischer, we've got two more, or maybe three individuals on the list. And we'll
Thank you, Chair Knorr. Thank you, Representative Jacob. I think a lot of it comes down to the whole concept of privatization is what is happening in that area. And what I'll point to is if we take a look at the services that we've had fraud in right now, the high-risk programs, it seems to me, from my point of view, is what's happened is we've contracted too much out and lost control. And I'm also speaking from my experience when I used to be in the private sector. We did not use contracted people very much at all, because as you start doing that, in some cases you start losing control because the contractors say, no, this is what our contract actually says. It doesn't mean I have to do ABC, even though we thought it did, and so we end up in the court system. That's usually what ends up happening, that type of situation, and that has occurred. And we've seen that happen at the state level. We've seen some of the failures that we've had on our IT side because we contracted it out. If you go back to MNLARS and you take a look at when we tried to roll out the Affordable Care Act a number of years ago, we contracted those out. It failed, and then we had a contract with somebody else versus trying to do it inside. So the question comes in is, when you're fighting back and forth with a contractor, you end up sometimes, when it doesn't work well, you lose all those dollars and the services don't get provided. So I do have concerns about as much contracting as we do out there. And in terms of, you mentioned unions, I've worked as management in a union establishment, and I will say as long as management did their job of properly doing the documentation, we did not have problems getting rid of problem employees. And that's what it comes down to, is as long as you're following the process and doing what's needed, you just have to make sure you got your documentation. And I will say it helps from several different angles, because whenever you terminate somebody, they can always sue you for just about anything. But if you got your documentation in line, you've got your protection there. And that's just coming from when I used to be in HR, doing the private sector, working on those kind of issues.
Representative Jacob.
Just one follow-up, Chair Norner. So with respect to fraud, and again, the ability, if there is fraud, the ability to fire that, whoever it is that's providing the service, just flat out, okay, we see fraud, we're going to eliminate that just very quickly, versus becoming bureaucratical and internalized. How do you see moving it to more internalized, given where we've been recently with all the fraud that we've exposed?
Chair Fischer.
Thank you. And as you're bringing that up, I think back to Feeding Our Future. Originally, when problems were found, they went to the courts, and the original court said, well, we're going to start fining you $10,000 a day if you don't pay the people. Once again, if you take a look at that situation, that was school lunch programs out there. And up until that point in time, school lunch programs were always provided by the school districts without problem. Now, in terms of responsibilities going forward, I would say that maybe what we need to be looking at is the system as a whole. Should the counties, 87 different counties, continue to be doing the work, or should we be looking at another system? And particularly when I hear very strongly that with the requirements coming in, we're looking at the requirements from the federal government are requiring a burden on the counties collectively that is over $100 million. So actually, should the discussion be, should we be overhauling the entire system and moving off the counties to another format?
Back to the state, probably. You'll say that. Representative Jacob. Representative Hicks.
Sorry, I was waiting so long that I got distracted. I just want to say thank you for trying something. And I think we heard today that there's a lot more work to do to make sure that we aren't leaving anybody behind in the something, and I appreciate your willingness to do that and to have that conversation. But I think our first testifier was really powerful for me when he shared, going back way before I was here, that there was a desire to try to make case management better, and that happened for a while, and then it just kind of fizzled out, right? And when things like that fizzle out, the reason it's fizzled out is because this body didn't act, right? There was a group, there was a conversation, and then none of, or maybe some, I don't know, I wasn't here, but whatever they worked on didn't come back into statute for changes. And weirdly, this is talking about waiver case management, but we have other case management in the state that looks completely different. Targeted children's case management, for example, has
caps. It has a monthly billable rate. It has, and it is contracted and not contracted. You know, it looks very different. The way we do case management in severe and persistent mental illness for adults looks very different. The way we do waiver case management looks very different. The way we do, not in this committee, but in children and families, the way we do child welfare case management looks very different. So perhaps, based on that first testifier and what you have shared today, Representative Fischer, and what we've heard from the counties and what we've heard from the wonderful folks that do case management in a lot of situations, perhaps the issue at hand is that case management is still broken. And it's still been broken since 2010 because we put together some groups and then the group fizzled and we didn't make the changes. Representative Gillman, the thing I love about your amendment is that it's ongoing. It continues into perpetuity. Because the truth of the matter is case management is something that is going to not look the same today as it did in 2010, probably isn't going to look the same in 20 years as it does today. So the ability to have ongoing conversations about what needs to change and what needs to happen is really, really important given the changing folks that are using case management. For example, in case management, did you know you can have 2 case managers? Did you know you can have a developmental disabilities case manager and a youth behavioral health case manager for kids? Did you know there's like some random admin rule buried into statute about who's in charge? It is. It's like buried. You can't find it. I have it if anybody's interested. But it produces confusion amongst county case managers, contracted case managers, families. Should we give them both case managers? Which one should we give them? Oh, well, now they qualify for a waiver, so maybe we shouldn't have youth behavioral health. But really, they're on the waiver because of the behavior, so maybe we should keep. It doesn't make any sense. And so if we're going to revamp a system, I would really like to actually revamp it. Listening to the voices of the people using services so we can, and people providing services, so we can actually make this work this time. I wasn't in the legislature when our first testifier shared about case management redesign, but I've heard that term a lot. And I was not aware that it had sort of fizzled. And so maybe that's a conversation we need to be having about how do we get back to what works for people, what doesn't work for people, and what are the safety nets to make sure that they have quality. Because accessing your case manager should not be the Hunger Games. And having a case manager be able to make a decision should not be impossible. Because the other thing that happens with contracted case management is they actually don't get to decide in the end. Everything goes back to the counties. And then when something doesn't work, right, when there's a disconnect between what the person and the case manager talk about and the county's like, no, not that thing. Then we're in this some kind of weird triangle conflict that no one knows how to get out of. And the only way we get out of it is an administrative law judge appeal, which is expensive, annoying, and backlogged for months. So people get no services while they try to fix the thing that is created by the triangle of humans, none of which is centered on the person. So I appreciate the work that we're doing. I think we maybe need to go a little bit further. I'd love to chat. I hadn't actually thought about some of those things until your first testifier. So I apologize for not talking to you about it before. But when I heard him speaking, I was like, well, okay. So if we could connect, I'd really love that. I'm glad this is being laid over, and I hope we can continue to work to ensure that case management is using Minnesota taxpayer dollars appropriately, and we aren't just spending money on some kind of circular discussion.
Vice Chair Kane.
Thank you, Chair. I want to go back to the Gillman Amendment. We didn't get a chance to discuss it because I know you pulled it, and I do appreciate your ability to work on it. I liked 1.19 on your amendment because it does identify geographic spread. I would just like us to go a little bit further to make sure that there's an actual percent listed. I think often when we do task forces, it is important that we have ongoing stakeholder engagement with like a stated geographic spread. Often we just pull people from the 7-county metro. So I appreciate you looking at that and just wanted to make sure it's on the record that I think moving forward, if we do a work group of this capacity, it always includes a large percent of greater Minnesota. Thank you.
Thank you so much. Just a quick question, Mr. Berg, do we have the total cost of how much we pay for waiver case management? You don't have to give us the number, right?
I don't know that off the top of my head, no.
So the specific budget that is allocated for the purpose of case management, that goes to the counties send to the contracted case management. So it starts from the state to the county then sends the money to the contracted case management. Chair Fischer, just a quick question. Do case managers determine the assessment, the placement, the service agreement, the rate that we're paying, and also the monitoring and supporting the participant or recipient of the service?
I missed the question. Say that again. I missed.
The process, the case manager is involved in everything about the recipient who's getting the service, from the assessment to placement to the service agreement to even determining the rates that we are paying, but also in addition to providing additional support and monitoring and ensuring that that individual is connected to the case manager. Is that correct?
That is correct.
So they do a lot of work. And that means we need to be looking into the whole picture. Where does it start from? Everything has got a place to start from. And that's one of the reasons that we wanted to make sure that they get compensated fairly, that we designed because it asked for us to increase the rates, and we never wanted to pay for that because of the same discussions. And Chair Fischer, do you recall a few years ago that we had the same discussion that never went anywhere?
Yes, Chair North. We've had it, didn't go anywhere.
That was my bill a couple of years ago, and we kind of shelved. We said, nope, we cannot handle it because it's not easy to solve problems. And so this is a time for us to look into your closing remarks, Chair Fish, and we will be done soon.
Okay, I want to thank the committee for the robust discussion and the feedback. This is something that will continue for a long time. One of the things that reminds me very clearly of, and we saw some of that earlier, is this is going to be an ongoing process. And as an example, we've done that in the behavioral health world. When I first started working on some of these things, when I had the behavioral health committee now 6 years ago, we started some of the reforms back then, and there was a good group of people and activists who kept on working with the department on an ongoing basis, and that's why you saw the bill earlier that Representative Gillman and myself put out. That's what we need to get going here in the case management world. So as we've heard from Representative Gillman, her amendment, we've heard from Representative Hicks there, is being able to say this is not just a one-time thing. This is something that's going to have the continued input going forward as the system itself continues to evolve. I want to say thank you, everybody, and with that, I would like to move that House File 3666 be laid over.
Chair Fischer renews his motion that House File 3666 be laid over as amended.
As amended,
So with that, we don't have further discussions. We are now adjourned.